However, there are those of us in occupational medicine, which is probably the closest related specialty, specifically dealing with toxic substances. And that's why I want to direct your attention to be able to go get help. I'm board certified in occupational medicine, and occupational medicine is a subspecialty of preventive medicine and public health. There are about 500 occupational medicine physicians in the whole nation. Most of them work for industry. There is a very small network of those of us who perhaps work in these areas, not working necessarily for industry. We're not corporate medical doctors. We work mostly with labor groups, with individuals who have problems, and with environmental groups. One of the problems that we discussed last night is that there is such a small network, and CCHW and lots of other environmental groups, and you and your own communities, have generated an enormous need for these resources, an enormous need for us. And the fact is that the 10 or 12 or 15 of us who really are dedicated to this kind of work are becoming rapidly burnt out. We cannot handle the needs that you people have developed. And if you are struggling with the mental side, I think you've probably run into that already. And so what I'm here to try and do is let you know not only about us, but try and give you some suggestions on how you can locate and develop other experts in your own community, dealing with doctors in your own area, and give you some suggestions about how those doctors can get in touch with others of us, like myself and others, in academic settings and universities and medical schools around the country, so that we can provide information and referral sources and some guidance to those physicians in your local communities whom you may identify as being sympathetic to your complaints and your causes. So that is going to be the main focus of what I have to say. I'm only going to talk for about 15 or 20 minutes because I really do want to hear the experiences that some of you have had, if you have had experiences in dealing with these kinds of problems. I know I'm going to hear a few horror stories. I'm ready for that, and I'd like to, if I can, provide suggestions. I want to let you know also this is not an easy area. I mean, I don't have, firm and pat answers. I think it's going to take a lot of work. Similar to the grassroots efforts that you've put on in your communities, we need grassroots efforts to bring along doctors who, by nature, I think, are somewhat resistant to dealing with some of these issues. As I said, there's no formal training. They have no formal organized professional group, and consequently, we have very few people out there with training. Really, I think one of the most important things to bear in mind is that through the development and the location of people in your community, starting off with a physician who has the right attitude. Many physicians will tell you, well, I see your problem, I think you have these symptoms, but I can't tell you that it's work-related, I can't tell you it's coming from the dump side, I just don't know, I just don't have any information. And I think these physicians feel somewhat pressured and yet isolated from information. And the things that you can do, if you can identify a physician who has the willingness and the right attitude, is willing to work with you and receive information from you. And, not a lot of physicians are willing to receive information from patients. Usually the flow of information is the other way. They're usually in the situation where they're telling you what to do or not to do, or that everything's all right or not. And so it's going to take some diplomacy on your part, in a sense, some organizing to be able to bridge that gap. And if you can, the first critical thing is attitude in physicians. No matter how intelligent, no matter how qualified, no matter what they're training, I don't care what their specialty, internal medicine, family practice, they may be allergists, they may be clinical ecologists, they may be any specialty. If they don't have the right attitude, you're really going to have a hard time in being able to utilize them down the road when things get tough. Because as you develop a relationship with a physician and as you get them to work with you, they may be put in positions that may be tough for them to deal with. They may have to defend their opinions in front of state regulatory agencies. You may be asking them at some point in time to testify at a hearing and come out publicly and support a position that they may have taken with you privately in a meeting or with an individual patient. The best way to deal with that, in my view, is to provide them with information and let them know that there's a larger community out there where they can plug into, where they can talk to other professionals who can provide them with the resources and the referrals that they need. And let me tell you where you can begin to locate first the experts in the field who you can then put in contact and network with these particular doctors you may identify in your community. Firstly, again, we're talking about occupational medicine because there are no environmental medicine organized groups. So where do you find these occupational medicine people? Well, first, there is the American Occupational Medicine Association, AOMA, which is a professional group that represents occupational medicine physicians across the country. They are a subset of the AMA, and I don't know what your feelings are about the AMA. I have my own personal opinions. I'm not a member. I'll leave it there. Most of the physicians, I think, traditionally in the AOMA are basically industry-oriented and by and large, but they can be a resource. You can at least identify some people, and I am not the kind of person who's going to paint everybody in an organization with one broad brush. There may be some people who you may be able to locate through them, and they can be contacted. That organization can be contacted through the AMA, which is in Chicago, Illinois. Okay? As an alternative, in part, to what some of us perceived as the industry domination of the AOMA, the American Public Health Association has a very large and active section now in occupational medicine, and in fact they even have an environmental health section as well. Two separate divisions within the American Public Health Association. Now the American Public Health Association, as I said, is a trade, professional organization or a trade organization for physicians in all areas of public health, everything from maternal and child health to preventive medicine, public health. But within that, there are these sections in occupational health and in environmental health. And in fact, the occupational health section has recently, in the last 2 years, set up a network of occupational health clinics. There are about 11 clinics throughout the nation on a regional basis, distributed throughout the country. This network of clinics, while they an actual individual clinic may not be located in your area, again, you may be able to contact the clinic in your region, and they may be able to refer you to somebody locally that they know, that they work with, who can be of assistance to you locally. Or if you have a specific problem that you can take the time to travel to where one of these regional clinics are, you may be able to get some help directly from them. They can be contacted through the American Public Health Association, which has an 800 number in Washington, D.C. I don't have the number with me, but all you need to do is call the 800 information operator and ask for the American Public Health Association in Washington, D.C. Once you get them, ask them how you can contact the Occupational Health Clinics Network. And they may be able to provide you with the names of occupational health physicians in your area. As well, they also have a listing of all of the occupational health physicians, and as well for the environmental health section. I know that Dr. David Ozenoff, who I guess has been in this session, in this track yesterday, I believe, and you've seen him this morning, I guess, is in the environmental health section. He does more environmental health than occupational health, whereas I'm in the other section. But in both of those sections, they maintain lists of members and where they're located, and you can actually get a complete list of people around the country, or I don't know if they will break it out for you by state or not, I'm not really sure, but you can at least begin to get a list that way. And we would hope that people in that section will at least be able to give you some information and be able to provide you with some resources. As well, in your own state, most state medical associations maintain lists of physicians by specialty. So if you wanted a dermatologist, you would call if you're in Indiana, you call the Indiana Medical Association, and they will tell you, well, in your area, here are the names of 10 dermatologists in your area. Same is true for occupational medicine physicians. Again, they will have no listing by environmental medicine physicians. So you need to ask for occupational medicine physicians. Okay, so really that's where I think the main ways in which you can plug into doctors who may have some specialized training and background in these areas. There are other people, however, who deal in this area and who have information who may be useful to you as resources. Toxicologists. There is an American Board of Toxicology, and there are certified toxicologists. We have a few here attending the session. These people can either be MDs or PhDs, but are experienced in dealing with toxic substances. I don't know where the American Board of Toxicology is located exactly. I imagine with a little bit of research, perhaps people at CCHW may know, you may be able to locate a toxicologist in your area. One of the best resources, and I don't think there's a state anymore that doesn't have a medical school, an academic center. Most academic centers have at least one toxicologist on staff, and usually more, because what you have toxicologists dealing with oftentimes is poisonings, either acute poisonings or overdoses and things like that. So they always have some kind of person in a medical school in the Department of Toxicology, or as well, many medical schools now have departments of occupational medicine. Again, no departments of environmental medicine, mostly they'll be under occupational medicine, and you should be able to locate some people in your state. And these academic centers, if they're located geographically far away from where you are, may be able to refer you to somebody locally. Other than toxicologists, all of you working in the field, I don't really know how you would access these people, but I just want to make you aware that there are other people practicing, such people as chiropractors, naturopaths, clinical ecologists, who may have valuable information for you and some resources, and if they can't help you, they may know people who they can refer you to. So if you're really trying to search around for people in your area, you may be able to locate some of these people. Finally, if you know any plaintiff's attorneys, people who have represented victims and represented communities in your area, often to support their cases, they rely on medical experts. And they may have developed a list of medical experts in your area. So if you can contact an attorney, they may be able to help you and guide you to a person who they've worked with personally, who they may know, and be able to assist you in some way. Other than that, I really don't have any full lists of people who can be of resources to you. And that brings me to my sort of second strategy, which is what I just touched on briefly before, which is finding doctors in your own community you can work with. And given that the time is short, and I do want to leave some time for interaction, I don't want to really belabor this, but it's my feeling that any and every physician can and should be doing occupational and environmental health to some degree. They all ought to be asking patients about their exposures, both in the workplace and at home, hobbies, drinking water, living near a dump site. If you come in with that problem, if you come in with that history, you ought to be sure that your general internist, your family physician, if you've gone to an allergist or dermatologist because it's a particular skin problem,